There's a lot of talk around the need for a national information network, and how do we really support that? I'm sitting here with Kate Berry, who is the CEO of the National eHealth Collaborative, and I'd like to know first what that is.
Great. So the National eHealth Collaborative is a public-private partnership that is focused on addressing, working collaboratively with many stakeholders to address barriers to health information exchange and to accelerate progress to achieve widespread health information exchange.
Are we moving in that direction naturally, or is there still some resistance from private and public groups to support this kind of network?
We're definitely moving in that direction, but it is a big challenge, both from a financial standpoint as well as workflow and technology. So the government as well as the private sector have invested dollars and have accelerated the progress toward more widespread health information exchange. But, challenges still remain.
What are the biggest challenges?
Well, it's complex, and we have such a complex healthcare environment, and there are a lot of barriers related to simply how providers are paid for different services. So implementing technology is not necessarily part of how they get paid. It is a tool to enable improvements in quality and improvements in coordination of care. But barriers are things like just understanding how to move forward. Barriers and challenges relate to governance issues and to workflow issues and financial sustainability issues. There are quite a few challenges, but again, lots of progress is being made.
How is the patient impacted by the slowness of getting some type of network up and running efficiently?
Well, interesting. Patients sort of assume that their medical information is actually electronic already. So I think the patients maybe aren't impacted as directly. However, I think, when we have a fully automated electronic system, patients will certainly benefit because they won't have to repeat all of their information every time they go to a provider. Their information would be more widely accessible, and the coordination of their own care among their providers would happen in a more streamlined manner. Plus, they'd have tools available to them directly to help engage more directly in their care. So I think we all have a lot to gain, both consumers as well as providers, as well as the government and every stakeholder that's paying for and being impacted by healthcare delivery.
So there's really a lot of things to do, really updating technologies that are in place now, training people, really putting in the manpower.
That's right, exactly. I think it starts with education and helping everybody understand what are the options to move forward, and it's helping various stakeholders to address whatever barriers they encounter, whether it's selecting a technology, implementing a technology effectively, helping with workflow and change management, and kind of pull it all the way through the other end so that we can all realize the benefits. But there are even the upfront cost issues. So, I think a lot of those barriers are being addressed, and it's going to be an ongoing effort to get the technology really implemented in a widespread manner.
In terms of cost, how do you envision who would pay for this?
Yeah, I think the purchasers, to a large extent, are bearing a lot of the burden. So whether, the government as part of Medicare and Medicaid is one of the largest purchasers of health care, but certainly private payers are also doing incentives for providers to implement technology to kind of help make that happen. So I think the payers, both private and public, are playing a big role. Providers obviously are paying to purchase and implement electronic health records, so both hospitals and physicians. And then, I think that in the cost of insurance, we as individuals are bearing some of the costs. I think the cost is spreading across pretty much everyone that's impacted by the need for having that technology in place.
Do you have some type of time frame in mind, Kate, on when this can be achieved?
Well, as I've said, there's a lot of progress that's happened, but there's still a long way to go. Let's say today we have roughly 30% of physicians have electronic health records in their practice. We have more than 40 states that are implementing health information exchanges, in part through public funding as well as private funding. So it's happening on a large scale. There are national federal players like the VA and DoD and others that are exchanging with each other and with health systems and health information exchanges resources at the state and federal and regional level. So, I think it's going to take some more time, could be, in the 5 to 10 year range to really have it, fully integrated across the healthcare system.
How can the patient be more of an advocate for himself with this information once he's filled out forms at his own physician's office? Should he make that other physicians that he's working with aware of that information as well?
That's a great question. We're actually just launching a big project, the National eHealth Collaborative, to bring together many organizations to try to create an organized program around consumer engagement. It's so early on. I think one factor is, consumers naturally believe health information technology is a good thing because they've been through automation and financial and shopping and travel. So I think they recognize that it's a positive thing. But I think there are lots of tools available, whether it's personal health records they can get engaged, the idea of being aware that they might want to ask their doctor, do you use an electronic health record? I think it's really a part of getting engaged at that level, being informed about what's possible and leveraging the tools available to us as an individual. How can I use these things to help be more informed and be more engaged in my own care?
All right. Kate, a long way to go. Thank you
Exactly.
very much.
Thank you.
I'm Mabel Jong. You're watching coverage of the World Healthcare Congress in Washington, D.C.